area. So if you imagine you've got a jeans pocket, and then you're putting your hand in your pocket, you're looking for about that area there. So that would be the area that you would put the ball on. But what I would suggest is you get to that seated position, extend the leg out, so your knee would be bent to begin with. Hopefully you can see that alright. That's the one. She's like, that's the one. And then what you would do is you pop your ball underneath that area and just make sure you've highlighted that area. You would then switch feet, so the knee would be bent. And the reason for that is because the piriformis is lengthened when that knee is bent. So you really want to try and get into that deep head of the muscle of the piriformis, because the sciatic nerve runs right through that piriformis. So you're in that knee bend position, and posture is really important with this as well. You want the heel of the hand to be directly underneath the shoulder, and you want both of them to be like that, and the body's upright. Why? Because you want to make sure that you're in a good posture position, because you want to get extra injuries, and also to make sure that the heart's raised so that you're getting some good breathing techniques from there. So from this position, you want to just sit. Now that might seem like a kind of strange thing to do, but there's a couple of things going on with that. It's allowing you to really focus in on the mind, the area that you are trying to work on. So someone that's got a lot of pain through that area, like yourself, Kelly, it's going to take you a little bit of time, maybe even just to allow the weight to sink into that area. So with my fingertips towards the heel of my feet, my elbows are slightly bent, my chest's up, and I'm just having that bent knee on the side that I'm actually going to roll. So however long it takes to be able to relax that off, that's what I want to be looking at. So the sequence of this will be a knee lift and back down. Now from that side, I want to just take my knee towards my hip, my knee towards my chest even, and for 4 times, I want to just bring that knee in towards my body. And from there, when I've done my 4, I'm then going to externally rotate my knee. And again, this is to make sure that we're getting all around the areas of that piriformis muscle that's deep within the glute there. And I would do 2 of those, and that would all I would be doing. The next sequence would be pivots. So your pivot would go twice. So it's a little turn on the ball externally, and then again, a little turn on the ball internally. And then it would repeat. Okay, so you come back down, let the ball come out, and maybe just get up and just get a little bit of blood flow. Because you've got that compression that's going down through the ball into the muscle, then that's going to help when you do release it to actually have the oxygenated blood flush back into that area and hopefully give you some healing qualities there as well. So it's really nice just to be able to get up and sort of walk about with that. Again, I wouldn't do too much of it. I wouldn't stay in that position for too much, for a long time, because what happens is you actually start to bruise the muscles. So it's not about the length of time, it's actually about just being really specific with the direction of travel that your ball is going in and making sure that you're just going around those pivots. So probably twice would be as much as you'd want to do. The other thing that I would certainly suggest that you do is to go into some sort of knee bend stretch after a hamstring stretch. So one of the ones that I really like is, I'm just going to move this round, everything's sort of hanging by a thread here. And a lot of times you think, right, hamstring stretch, I'm going to do this, but a lot of people actually even do this wrong. So what happens is you say, right, touch your toes, and everybody sort of bends from the back. So what I'll do to ensure that you're getting that hip tilt is actually use just a wall. So actually, I've got that here, I'll just sit here. So I've pop my mat right up against the wall. And again, this is going to depend on the flexibility of your body. I'm just going to extend my feet out into straight, and sometimes if you've got really tight hamstrings, this might be something that is enough for you. But lift the cheeks up, set the body, and lift the body upright. If you're feeling good with it, you can gently pull the toes towards your body, try and soften the knees at the same time, and that sometimes has got a really nice stretch for you. For the muscle to actually get a true stretch, you're really looking for 20 to 30 seconds hold, breathing all the way through it, take a deep breath, extend, and then get a little bit deeper. If you're going past this point of stretch and you're not feeling any stretch at all, then of course you can hinge from the hip. Remember, as you bend over, that's going to be less hamstring and more upper back, which is fine, but just now we're looking to stretch off the hamstrings. So your point of call would be 20 seconds, 20 to 30 seconds, hold, stretch, take a deep breath in, exhale, get a little bit deeper, 20 to 30 seconds, exhale, get a little bit deeper, inhale all the stuff, and then bring it up, and then get a stretch off. So that would be your hamstring stretch. And then certainly one of the better ones to be able to do the actual piriformis would be that bent knee stretch. And the pigeon is a really awesome stretch, and depending on like if that suits you or not. The pigeon is a really good one. I'm pretty sure you know how to do that, but I'll show you anyway. And again, I'm just showing you one leg. So your pigeon, you make sure that your hips are square to the front. I would take my foot up and then take the leg across the body, and then depending on your flexibility, you want to square your hips up to the front. And the important part here is obviously your knees bent, but also this part here needs to square up. So the leg that's straight at the back, that hip, you want to point towards the floor. So that might be enough for you. If you're getting a stretch there, the same rules apply for the amount of time that you're going to stretch for. It would be a deep breath in, exhale, and so on and so forth. It's going to be very much dependent on how your flexibility is. I mean, from here, you might be able to get all the way down to the ground, and to be able to increase that stretch from the ground downwards, it's really that hip tilt that will make the big difference, because that's allowing the leg to be anchored onto the floor and the hip to be driven towards the floor to stretch that out. And someone that's got really great, and I'm not saying I've got great flexibility through my hip flexors or my glutes, but you'd really want to be looking for that 90-degree angle at the knee as you tip down through that pigeon position. So that's a really, really good one to be able to do. And then obviously you've got your final stretch that I would suggest, and that would be the one where you're here, your knees bent, gently push in, either through the triangle this way underneath the hamstring, or all the way around the top of the tibialis there, and then gently bring it down. Now the idea is that you're going to push down through the hip whilst pulling in. So from that stretch there, you're getting a double dunker there. So you're almost getting a P and F stretch there, because you're pushing this external knee down towards the ground this way, and also your lower back's pulling down towards the ground. And again, once you get that position really nicely, you want to be starting to think about the timing that you're going to be doing it there. So 20 to 30 seconds, that's going to allow your muscles to actually switch off and be able to stop firing, so it's not holding on. And that's at least, especially if you've got sciatic pain, and the breathing, do it at least 3 times. So that would be my advice for that. So a quick sort of, who's there? Anyone? Oh, that's alright, Kayla. I'll save it as well. Who have we got in? Yeah, so any questions, if you've got any questions and stuff, just fire them in. I think there's a little square box underneath. So I'll keep this up for 24 hours. If you've got any questions, like, click that square box and you can type it in, and I'll answer the questions as they come up. But really, foam rolling, that'll help, that'll decompress, that'll compress the muscle, and once it's moved through the movements, then it's going to help to flush all the new blood, all the new oxygenated blood through that area. Make sure you're on a bent knee, make sure you take the time to actually just let the body relax onto that. If that's too much, because the pain for sciatic pain and the piriformis syndrome, if that's what it is that you've got, can be excruciating, please feel free just to use the foam roller, or even, you know, one of these yoga foam rolled up mats. That might be just enough for you as well. So please just go with your own pain threshold with it. And I would certainly suggest as well getting yourself in and getting yourself a massage, because if you can find a really good masseuse, you've nailed it. But sometimes it's pretty hard to find someone that's really good. I used to do a lot of massage, but not so much now. Yes, of course, Julie. The ones that work are the ones that never really change. At the end of the day, the anatomy, it's always going to work the same way, and if things are working for you, then keep doing it. But it's really good to know that that 20-second hold is what's really going to help developmental stretches with it. So hopefully that's helpful to you. And hey Lynn, nice to see you. Missed you at class today. Alright, so I'm off now, and if there's any other stretches and stuff, I'm going to do, I think someone asked me for something else. Oh, it's pecs, so I might do the foam roller with the pecs a little bit later. So hopefully that's interesting to you. I'll pop that into my group as well. Good to see you guys. Thanks for jumping on. Bye!